very exciting for us to be joining and gathering again, because we're talking about a topic today that actually is very near and dear to my heart, because we're talking about ear infections. And I will personally say I suffered from recurrent ear infections as a child. I had tubes placed in my ears at the age of 5 and had recurrent ear infections, sore throats, and was on that 5-day Z-Pack ongoing until they finally realized that, oh yeah, azithromycin is probably not fixing the problem. In fact, you're becoming immune to that. It's just a matter of time until you probably need to get your tonsils, your adenoids out. And I can say, rewinding, after I had tubes placed in my ears at the age of 5, which clearly didn't resolve the problem, that I had those ongoing until the age of 22. And what was different at 22 was that I started chiropractic college. Started getting adjusted, obviously not the best types of adjustments because they were done by students. As we all know, being chiropractors, we've got to learn somewhere, right? But that was still powerful and very effective for me to no longer have that horrible ear infection, or I'd have at least one absolutely horrible one to the point to where my eardrums would nearly rupture, as per the whatever physician that I would go and see, because the pain was so excruciating. But yeah, so it changed my life from chiropractic, and that obviously is something that now I'm really excited for us to be talking about, so that way we can really empower and inspire and hopefully save so many kids from having to go through the surgery and it be ineffective, because we'll go into talking about that and how that's not the only problem, the reasons why kids have ear infections, and then if they grow up to be adults that don't have them resolved, having ear infections as well. So that being said, what is an ear infection? Well, ear infection, there's different types of ear infections, as we know, because there's different areas of the ear. There's inner ear, the middle ear, but the most common one being otitis media, meaning the middle ear, of course. And how does it happen? Well, there's the various reasons where it happens. So I'm combining several questions here as we go through this, because the most common question is, what is an ear infection? What causes ear infections, and what are the symptoms of it? So I'm going to loop those all together. So ear infection being an inflammatory reaction happening within the middle ear or some aspect of the ear. So we'll talk about otitis media specifically being in the middle ear right there, because that's the most common one. And there's pain with it, there's inflammation, there's irritation. And so, of course, you can see with kids that may not be able to really say, I'm having ear pain. They may be tugging on their ears. So you can see them tugging on their ears or putting their hands around their heads, or indicating that they're having discomfort around the area there. There could be fluids draining out of the ear, or ear wax. They can have excessive ear wax in there. You'll notice that there's yellowing. There's a discoloration of the serum or the fluid that's coming out of the ear there. And the fact that what kind of causes it is, well, again, multiple things. There's definitely a neurological component, as we know. There's a physical component, a mechanical component, and structural components of it. Commonly, especially with little kids, because whenever we come out, our ear tubes are horizontal. And as we get older, they're supposed to go more downward, so that way that helps with the drainage of fluid. And what ends up happening a lot of times is maybe as a child is growing up, their actual eustachian tube or ear tube is not dropping down as quickly or as properly as it should be. And so now that already is a mechanical issue that's disrupting the fluids from being able to drain out of the ear. Well, another question might be, well, why is it that you're like, oh, so it's a genetic thing of why my tubes just failed to descend down? Well, it's not just that. Well, why did the body not understand why it needed to develop the tubes to be able to go down like an adult's would? Well, there's a neurological component in there. So the neurological component, could there have been subluxations, which we know as chiropractors, we look for and detect subluxation. Where is there irritation along the nerves, which the nerves communicate and control everything inside the body, and of course communicate more specifically with different areas of the body depending on where it's located. But in this case, in the upper cervical spine or in the upper neck, being the atlas in that region right there, if the atlas is compromising or maybe putting a little pressure and irritation along the nerves, which is everything coming through the top right there, because as we know, the spinal cord goes from the top, works its way all the way down, but right through the head, the skull, we call it the foramen magnum, which we also call it the mouth of God, or the mouth, because it's literally all the information that goes through the spinal cord is coming through that top hole right there. Everything has to pass through the top to work its way down. So yeah, I'm talking specifically about the nerves coming out through the top bone right there, but if that top bone is shifted, if it's up or down, left or right, or rotated or whatever, doesn't need to be a lot to press off and not allow the nerve to fully communicate the way it needs to. And that could be the nerve that is communicating, going directly to the inner ear, to the middle ear, to the different elements of the ear, to the muscles in and around the ear. So then there's more mechanical issues that happen there. There's a muscle known as the tensor veli palantini, which is a common muscle that gets inflamed whenever there's subluxation, that gets tense to try to support and balance the ear, and it puts pressure on the inner ear tube. So now it's even cutting off the tube. So now there's a smaller diameter, not allowing fluids to drain as well. So you see how it goes deeper and deeper and deeper. And it's so important to find out what is causing the ear infections. Commonly, which we're going to get into it because I can go right into it because I'm so passionate about this. Common causes are failure of the tubes to descend the way they need to, accumulation of fluids inside of the ears. Now maybe there's an accumulation of fluids that aren't draining, and so now that becomes a very good harvest area for bacteria to pick up and start growing, which is why it becomes an inflammatory issue. We call it otitis media. It's an infection because now there's bacteria growing. It's a perfect harvest area for that to be there. And then now they're just continuing to populate, and the inflammation process, which is natural, the body's responding to it, but as things start to swell up and redness happens, the eardrum, the pressure will start to build up behind the eardrum, and then now that pressurizing in that area there is really uncomfortable too, extremely sensitive area there. So then of course there's different mechanisms. That's why they give you antibiotics, because of the bacterial growth. They're like, well, at least let's kill off the bacteria, try to help that out. And then there's definitely different mechanisms of trying to break up the earwax accumulation that might be happening there to try to help with the fluid. Hopefully we can use chiropractic. Again, I'm going over some of the other commonly asked questions that you guys will get into as well. So I'll try to wrap it up in saying the symptoms are, of course, pain, irritation, pulling on the ears, but it also gets and is connected with ears, nose, throat. So you think sinus or like sinus drainage. You also think sore throats are very common to happen as well. So those will kind of get wrapped. Sleeplessness, restlessness, irritation. It could be a fussy, colicky baby because the colicky baby is crying because of the discomforts because of the ear infections happening. So there's a whole slew of different symptoms that are associated and happening around the same time that ear infections are happening as well. So that wrapping up, I think this leads right into another beautiful common question, and I kind of already answered it. But Dr. Lee, if you can talk about a chiropractic care can help with ear infections.
So we absolutely see chiropractic care helping with ear infections weekly. We have a lot of kids that we've come through here, and I'd say the overwhelming majority have had significant relief despite having tubes in their ears, similar to your story, you know, having tubes, being on antibiotics, having recurrent ear infections. And even to get tubes, you have to have had ear infections for like 4 or 5 times within like a 6-month period or 8-month period or something like that. I don't know the specifics on it before they qualify to even have that discussion with you to put tubes in your ears. So the minute they're discussing having tubes, that kid is having a lot of ear infections, and these are a lot of kids that we see. Parents are bringing them in, and they're in that situation. So it's not some fluke when they start getting adjusted and it goes away that there was a significant difference. It wasn't just, you know, a timing issue or they were just going to grow out of it, because these kids weren't growing out of it. And so we see that it's a very powerful response to the adjustment. And because of that, it's very easy to think that there's some specific magical adjustment that we give to cure ear infections. And that's not the way that it goes, because we have to look at the body and understand that it's a whole system. And as chiropractors, we're actually not sitting here looking at the symptoms necessarily. Like, oh, you have ear infections, so I'm going to concoct a recipe to help you with the ear infection. What we're looking at is if there are any problems in the spine that we can now detect and correct, then there's a good chance that that is actually the issue that is causing or triggering the ear infection. So the helping with the ear infections is really a side product or a side benefit of what we're actually focusing on within chiropractic, which is really cool, because then there's usually other benefits that people will have as well. But I think it's important too to kind of recap in a simple way what an ear infection is, because you gave us a lot of awesome information on what an ear infection is. the way that I look at it is just real simple, is that your middle ear should be draining. And it drains, and we all know that it can drain because you'll feel like it drains into the back of your throat. And it drains into the back of your throat through what's called your eustachian tube. And as you pointed out, the eustachian tubes when you're a kid are horizontal because your head and skull hasn't developed fully yet, so you still have a lot of growth that has to happen. And as you grow into an adult, they actually start to tip down, which makes the drainage happen easier. It's like a slide, it comes right out. But if there's any type of compression or something that's blocking that eustachian tube from draining, if it's horizontal, it's very unlikely to drain. That's why kids suffer from ear infections more often than adults. And we see that as a very common thing. We'll still have adults that get ear infections, but kids get them a lot more often because of the anatomical position of the eustachian tubes. Now, interestingly, the top bone in the neck, which is your atlas, sits really close to where that eustachian tube is, and there's also nerves that come out, like the palatini muscle that you talked about, that actually then pulls, is a smooth muscle that controls and tugs on how that eustachian tube moves, which is why you can clear your ears. And when you open up your jaw, you can kind of feel your ears starting to clear. Whenever you do that, it's because you're actually activating some of these muscles that are tugging on that eustachian tube. But those muscles are under control of something. They're under control of the nervous system. So nerves are controlling that. And if you have irritation that's going to that nerve, now guess what? Now you may not be able to clear your ears the way that you're supposed to, whether you're a child or you're an adult. And now when we start making adjustments, we're definitely very commonly adjusting the atlas, which is that top bone in the neck, and it has a very strong, powerful connection there. And I remember Dr. Kim at Life University, he actually had done a dissection lab, and he had done a faculty case review because he had dissected out and shown the connection between the atlas and the eustachian tube. And this was in an adult, this wasn't in a kid. And he was actually looking at strictly the mechanical connection between the two, not even the neurological connection. And mechanically, the outside edge of the atlas, he actually showed how what could actually constrict and irritate the eustachian tube itself, just by the position of, like, a slight difference of position of that atlas on the eustachian tube. And so that always stood out to me, that there's many different ways that the eustachian tube can get obstructed to then lead to ear infections. And what we're dealing with as chiropractors is we're focusing on the spine, clearing the spine of subluxation, making sure that it's, one, biomechanically sound, but even more importantly than that, neurologically sound. Is it functioning the way that it's supposed to? And when it is, then all these other things, like ear infections just being one of the many things that will benefit, will be of benefit when you clear the spine, is ear infections. And so when we look at something, people ask if we can help with ear infections, the answer is yes. Like we see it happen all the time. We can never guarantee anything because we don't know how everyone's body is going to respond. But if you just look at a large sample of people, the overwhelming majority of kids coming in with ear infections have dramatic benefits, not just with us, but with chiropractors in general who are working with this type of population of taking care of kids. So it's a really cool thing. So I know we're kind of running into each other's questions here on how we're discussing this, but it's good to get different takes on each one. So Dr. Chris, could you dive into how chiropractic care helps with ear infections?
So you were kind of talking about it. There's a lot of anatomy that is right here. So if we have improper motion in the spine, specifically that atlas and that cranial motion that happens at the top, if it isn't motioning correctly or we don't have proper nerve, vein, artery, bone function through this area, that can cause pressure on that. So if there's pressure on that eustachian tube, improper drainage happens. Things back up into the middle ear. Like Dr. Nat was saying, it can start to get inflamed. Everything just starts to pack up. So you get a lot more opportunity for bacterial growth. So you get the infection to start growing. As we start to restore biomechanics or function of the spine, this allows proper drainage to go down the throat. But that's why early on you can see things like irritation going down the throat, especially early in chiropractic care. They start getting that proper motion, everything starts to drain. Everything starts to heal. But that's a very short-lived cycle, because as they drink water and they get better motion, everything heals. But so since we've talked into other areas, it was kind of on my heart to talk about it too. This is the importance of women during pregnancy to get adjusted. If they do not have proper motion whenever they go to have a vaginal birth, this doesn't allow proper cranial molding to start happening whenever the baby is being born. This can allow improper motion to start to develop whenever their eustachian tubes are starting to drop down or shift as they're growing. So if from birth, if that wasn't taken care of or the cranial molding wasn't happening, they're not going to have proper drainage early on. They're going to have ear infections from the very beginning. So that's the importance of taking care of the mom when they're pregnant, and then getting the baby checked as soon as they are born. Get that checked. Even if they had a C-section for some reason, start getting the baby's normal spinal biomechanics to start functioning so that they can start to mold. Tummy time, start to get them to pull their eyes up, start to get their head to mold. Take pressure off the eustachian tube, get their spine functioning like it's supposed to from day one. It's very important. So we had talked about other things. You talked a lot about how does it help. Restoring proper spinal motion affects the bone, which affects the nerve, which affects the muscle. If you get those in balance, everything starts to work like it's supposed to again. Your body is perfect. You just have to give it the right conditions. Mm-hmm. And this is what chiropractic care does, is it helps restore that to give you that proper motion, to give you the healing ability. So that was on my heart to talk about that one, but I'll go on to the next one. So is chiropractic care safe for treating ear infections, Dr. Sean?
So I feel like there's a lot of layers to this question, so I want to unpack this, and then maybe we'll roundtable this question a bit as well. But let's look at the first part of that. Is chiropractic care safe? I mean, absolutely, chiropractic care is safe, so we can answer that question. And then as we dig into that, I think what we're asking, can it help with ear infections? And as Dr. Lee and Dr. Nat and you've all been talking about, yeah, we see great benefits on how it can help with ear infections. But then there's another side to this. Is it safe for treating ear infections? And we got to be clear, we don't treat ear infections, right? We talked about the biomechanics and the neurology that's related to this, but there's really not a specific adjustment that treats or cures an ear infection. So what is it that we're really doing? And what we're doing is we're going through and checking the spine for subluxations, and we're clearing the spine from those subluxations. And when we do that, we're removing interference that could be happening in that nervous system, in that spinal cord, which is really that gateway between brain and body and allowing us to express health, express life, right? And when we clear those subluxations, that pathway, that highway starts operating at a much higher function and a better level. And we see a global impact on the body through connections between the nervous system, the immune system, the endocrine system, connecting the body to the brain, and that whole system starts coming back online. And through that, we can actually have better communication to what's going on with this whole complex in the ear. Is it an immune system problem where we're having too much bacteria building up? Is it eustachian tube? The brain just knows intelligently, the body, the wisdom of the body knows intelligently what to go after, and it's going to go and heal it on its own. And so we don't really do the healing, we don't do the cure, we remove the subluxation and let the body, through its own wisdom, go to work. So I don't know if you guys wanted to add to that.
Amen to that. That's just like, I'm like, yes, like we're so blessed to be able to be in the profession that we're in. And we're so blessed to be in the profession that we're in, to be able to do what we get to do, exactly that, like already the innate intelligence, that wisdom that's within, that spirit, that life force, that energy that's housed inside of our nervous system that tells everything what to do, how to do it, when to do it, and how often to do it. We're just allowing that to freely flow and freely communicate and freely be able, and to be freed up to be able to do what it was designed to do, remember it or do it again or do it for the first time, whatever it might be. And so exactly that, yeah, it just gets me so excited. So like talking about ear infections, I wish my parents knew. I wish my parents knew to take me to a chiropractor early on, because they did what they thought was best. So I'll add into it in there. Like, parents do what they think is best, and you parents that are listening to this right now, with your kid, like, you go to the medical doctor and you're going to be told markedly different. They're not going to be reminding you about the power of the body. The power of the body heals the body, is what we like to say if we just like put it very short and sweet. But they're not going to remind you of that. They're going to look at your child as problematic. That something's wrong with them. They need fixed. Mm-hmm. And so they're going to want to usually give them antibiotics, obviously, to try to kill the bacteria, not even thinking about why did the bacteria start to grow and harvest in that area to begin with. Sure, they might be talking about the fact that the eustachian tubes haven't descended, and so now your little one is a problem child because their eustachian tubes had a failure to descend the way they're supposed to, which is actually extremely common.
As part of normal development.
Yeah, it's part of normal development.
Like
it's supposed to be slower.
Happens. Yeah.
But of course there's other factors of like what we're eating, other things that are creating inflammation, irritation inside the body, and is the baby even breastfed? That's another thing too, because breastfed children are automatically getting natural immunoglobulins. They're getting the natural vaccination, if you want to say it that way, to be able to allow their immune system to be supported. And just the way that body is designed, or that baby, it needs it, and the way that baby is designed, because mom is producing it herself, because the innate wisdom of the mom's body knows what to produce for the baby. It's just incredible the way that mechanism works. So it's very common for kids to also get ear infections just from the inflammation of them being on formula as well, because formulas it has cow milk in it. It has other things and crap in it that babies were not designed to have. Human babies are supposed to have human mama breast milk, not cow milk.
Well, you just talked to a fellow chiropractor, what was like a month ago.
Oh.
And what was the story?
The story was, it was actually it was another fellow chiropractor, and he was just very concerned about his granddaughter, because his granddaughter has all this skin breakout on the top of her head. And they want to just keep putting antibiotics and steroid creams on the baby's head. And she also was like having like congestive issues and stuff like that. And he might have mentioned about ear infections, but the main concern was the fact that you could just see she had like all this scalp skin irritation happening. And the breakouts on the face and on different parts of the body. And I right away was like, you should cut out dairy. Meaning not just like cow milk, but yogurts and ice creams and anything else, like cottage cheese, anything else that, you know.
And then you said to check the formula.
And then and he kind of looked at me because he's like, oh, well, the baby's not just drinking milk. I was like, oh, and then he had mentioned, I was like, well, is she breastfed? And he was like, no, mom had a hard time breastfeeding or whatever the story might have been, but regardless, he was like, no, she's on formula. So she's not drinking milk, she's drinking formula. I'm like, you need to look at that formula, because on the back of nearly all formulas, there is cow milk inside of it, let alone other things. And he kind of just looked at me because he raised an eyebrow. So not even all chiropractors know this as well, and nothing against him or, his practice or anything like that. But we don't know these things. Like even other physicians and other chiropractors don't know this as well. So me, in reminding of him, that was last month, and when we just met up again, he was like, hey, I want to let you know. And I go, what? And he was like, so mom stopped giving her the formula and cut out milk, and her skin conditions like cleared up in days.
Yeah.
I'm like, and it felt so good. I'm like, amazing. I'm so happy for you, because he was such a concerned grandparent, and he felt at loss because he wanted to be able to help his daughter and help his granddaughter out. So kind of got on a topic about
but there's
that.
It's common. A lot of times people think that there's a problem with the body, right? Like, oh, there's a problem going on in the body. We have to fix what's happening in the body. And chiropractic looks at things differently. Yeah, obviously we're focused on the spine, and we want to make sure that connection is there. But on a deeper level, our philosophy is different. We look at the body as being whole, as being healthy, as being perfect. That it's not just abnormally doing something like having a skin breakout or having ear infections just for the sake of like, oh yeah, something's weird in there, and maybe something is deformed, or there's a problem with you as your body. Versus now we look at no, there's something that is impeding your body's ability to express health. Yeah. So there is an interference to your innate wisdom that is guiding itself from being able to heal. And in fact, the symptoms themselves are that wisdom that's being expressed. It's a little alarm bell that's happening. Because if your inner ear or your middle ear has an ear infection, is it the bacteria's fault that they're inside of the middle ear? Because we better put them on antibiotics is the knee-jerk reaction, and is the standard of care. Put them on antibiotics because you can't have bacteria inside of the middle ear. Well, what did the bacteria be like? You know what? They're sitting outside and be like, we're gonna go after that kid, and they jump in there and then they settle in the ear. Or is it a response to the fact that you have fluid that's built up inside of the middle ear that's stagnant? And how does nature in her divine wisdom handle stagnation? Well, it has to break down all those waste products. How does it do that? That's what bacteria are. They're like the janitor. They're the janitor system of the world to make sure that the little microbes clear it out so that it can break it down. So they're there to try to break down this waste that's sitting there, and it just so happens to be there. And what really has to happen is we need flow again, because there was an impediment to the ear draining. And you can go through and you can poke a hole through the eardrum and say, hey, we'll get it out that way.
We'll relieve the pressure that way by doing that.
But that's basically because the eustachian tube isn't draining. So we can go through and poke a hole through the eardrum, and then or surgically put a little tube in there so that it drains out that way. But we've ignored the problem of the fact that the eustachian tube isn't draining. And so the perspective of chiropractic is there's something that's interfering, and that might be something that we're doing that's basically poisoning us in a way. Because unfortunately, dairy is kind of like a toxin. Mm-hmm. I mean, we can pretty closely put it into that category of having toxic effects to the body, and that just stands out of my mind, that the way that we look at things, because our philosophy on life is different. Because we respect life, and we look at life as being perfect and whole and connecting in together, that it changes the way that you view a quote problem, because we don't see it as a problem. There's a reason that something is happening, and we need to assist the body by removing interferences to let the body heal and do its own thing, versus resorting to assuming that what the body is doing is wrong.
I mean, and really, let's be real, bacteria gets a bad rap, but bacteria is not really the problem. They're not a bad thing. We need them. In fact, they outnumber the cells in our body. We have more bacteria in our body than we do actually have human cells, because they carry out so many vital functions working with the body in different things. We have it on our skin, we have it all the way through our digestive tract. I mean, bacteria is everywhere, and it's an essential part of what makes us human. And so to go to the bacteria and say this is the actual problem, when in reality, as Dr. Lee was saying, hey, this is actually an alarm bell going off. There's something else going on. We're not able to express health and healing, or we're trying to get something to heal, and it's creating these symptoms. And that's when people all of a sudden run to their MD and say, hey, we got to do something about this. And well, what's in their arsenal? Drugs or surgery, right? That's going to be the options that you're going to get when you go there to try to correct it. And as you said, we look at this very, very differently. We want to look at the body as a whole, and how do we get that whole system working a whole lot better.
Yes.
Really figure out the why.
Yeah, and it can be complex, because I think bacteria is something that's important, because it's a microbe that everyone, like, who hasn't been on antibiotics? Let's get real. Like, everyone's been on antibiotics at some point, for like almost every single person.
But then you got to repopulate it with some probiotics, right? Which, think about it, even though it's a whole other conversation going into probiotics, but what are the probiotics? They are bacteria. They are the, quote, good bacteria that you're trying to replenish your body with after wiping out all the bad bacteria from your body, or, quote, bad bacteria. But really...
But they have to eat something.
They have to eat something. And the bacteria is like the canary in the coal mine, right? It's letting you know, like, hey, some other deeper issue is going on. Same thing you could say, and it's switching gears just a little bit in relation to like urinary tract infections and UTIs and yeast buildup and stuff. A lot of people want to take steroids and creams and antibiotics, same concept for these kinds of things, just like ear infections, because again, the canary in the coal mine is like, with the bacteria being there, it's like, oh, like, we found it, we've detected, you've got this stuff here, we got to get rid of that. But it's like, no, why is that showing up there? Why is that accumulating there? Why is the bacteria accumulating there? So, yeah. I think it goes into the other, well, we talked about the benefits, which is specifically, what are the benefits of chiropractic care for ear infections? Well, we have all been talking about that, and we'll just repeat it again, that because we're focusing on the body as a whole, as a holistic system, as a fully functioning nervous, chemical machinery and physical machinery that our bodies are, we're making sure we're removing whatever is interfering in the body as a whole, not just specifically like, oh, there's the ear infection nerve, let's make sure we talk to that nerve and make that happen. It just so happens that we may be adjusting the area where, yes, that does go and communicate to the ear, but we might be adjusting other areas of the body too, because the body needs it, so it can be full cohesion and harmony and balance of communicating from the top to the bottom, inside and out, and outside and in for that matter as well. So The benefits of chiropractic care, well, obviously alleviation of symptoms of accumulation of fluid. Now the fluids start draining. Dr. Chris was talking about that earlier. Fluids start draining in the ears. The fluids start draining from the nose, from the mouth, and the back of the throat right there. You're going to notice the benefits of also not having recurrent sore throats on a regular basis. As I shared from the very beginning, when I started getting chiropractic care at the age of 22, I didn't even change anything else at that point in time. Eventually I changed my diet as well. But I just started getting adjusted, and I no longer had recurrent ear infections or sore throats anymore. And my neck, if you were to see what my neck was like, I mean, it was an absolute mess. I had a reversal, I had like an S curve. So we as chiropractors know, we're like, oh, reversal of curve is what we talk about, but I had an S curve. Very fun looking from the side view right there. So my neck was so messed up in the sense that, yeah, absolutely my atlas was putting irritation on my eustachian tube. That absolutely slowed it down from having fluids from draining. Is it important for me to have ongoing and ongoing chiropractic care? 100%. Not because I'm just afraid of getting ear infections, but because I know what it takes for my body to operate at a high level. So the benefits are also not having any of those issues anymore. I don't have to have a zithromycin or whatever else inside of a medicine cabinet or anything like that. So it's alleviating other areas of your body at the same time, just because the body is communicating and functioning the way it needs to. So we'll go back to, how long does it take chiropractic care to work for ear infections? That's a good question, right?
Yeah. So that's one of the first things people have is like, how long is it going to take before I know if it's working or not with my kid, or if you have as an adult you have ear infections. There's no real cookie cutter answer. Unfortunately, like for each individual, they want to know an exact. We were actually talking about this yesterday. There was a lady like, I need 100% guarantee that this is going to work, and I need to know exactly how long it's going to take for it to work for me. And it's like, well, that's impossible. We can't give any exacts out because every person and situation is different. Your life experiences are different. The stresses that you're under are different. How the nervous system is going to respond and how long it's going to take for the body to heal is going to be different for every single person. So with that, we don't know at an individual basis how long it's going to take, but in general, we have a track record. We keep statistics in our office. We pay attention to how long it takes for, out of 100 people, what are the averages look like? And in that case, usually I'd say people start noticing changes or benefits in like kids with recurrent ear infections probably within anywhere between 2 weeks to 2 months. Like that would probably be the average. That means it can happen faster than that. That means it can take longer than that. And it can be a tough pill to swallow sometimes if someone's like, hey, we've been at this for 3 months and they're still having ear infections, but all of a sudden month 4, boom, it's gone. And they don't come back. So it's really important to understand that you can't look at it in this short-term thing, because again, we're also not trying to treat the ear infection. We're looking at optimizing the body by making sure we keep the spine clear of interferences of how the brain and the body are communicating. And when you do that, it's like, hey, keep it clear, keep that communication, that channel moving the way that it's supposed to, and just sit back and let the innate wisdom of the body do what it needs to do at the pace that it needs to do it at. And we are always so eager to push things along and speed it up. And I mean, we're in this for results as well. I mean, if we weren't getting results and we weren't interested in results, then we would not have as large of a practice that we do. But so we get great results, but it is in respecting the body's timetable, and the innate wisdom of the body knows what it needs to do. And so a lot of times our job as the docs is to sit back and basically be a cheerleader and just be like, hey, just like we're cheering on the innate intelligence of your body, and for you to sit back and be like, oh my God, is it gone yet? Is it gone yet? Is it gone yet? And be like, hey, just trust that, we're one step closer. We're one step closer. It's like the little kid in the back seat. Are we there yet? Are we there yet? It's like, mom and dad, our job is to be like, hey, just hang in there, or like we'll play Moana songs, one more time. And we'll be there soon enough. And that's how the body goes. It takes time, it takes repetition, and it takes consistency. But there is a general timetable, like I said, and it's usually 2 weeks to a couple months is the average. And some people, it's like boom, they get that first adjustment, ear infection goes away, fever breaks. It's like oh my God, this is amazing. To the ones who are like, it takes longer. But either way, that's the best answer that I can give for
I want to
how long
add
it
to that
takes.
though, with that, like not only are the cheerleaders, and we, you know, of course we quote, we sit back and we continue reminding you of the innate wisdom of how your body's healing every step of the way. But we also have that timetable that we're looking at. What are the other things that can be affecting you specifically? Are you drinking dairy? Is the child on formula? What are other things that we can suggest? Because we have in our head that it can generally be between, like we said, 2 weeks to 2 months. So we do those re-exams in our office, which are so crucial and so important because we're checking in. And we're also, we're going to ask about the main issue that you might have, which is ear infections. And then we might say like, hey, what kind of things are you noticing that might be different? And in fact, we'll figure that out along the way. But definitely in those re-exams where we can give you added suggestions of, okay, this is happening a little slower than what I anticipated. Okay, what's the home life like? What other things are you doing as far as your diet and stuff like that maybe you need to cut some things out of like as far as dairy specifically. We can go hone all over that, and gluten is another thing, and sugars, the sugars that you're having, like what are you consuming? What are you feeding? What are you eating? What is the child eating? So we're able to give you like that addition in there, so we're removing the subluxations, but subluxations can come in other forms. Right? And those other forms can be what is also, like I said, like through dietary changes, through making sure you get outside, drinking plenty of good quality clean water, and moving the body, and what are the stressors that could be happening on in the life there. So having somebody like a chiropractor, like what we can say specifically what we do in this office is we're following you along the way to be your cheerleader, but also to give you the other resources that you need that could be contributing to it as well.
Mm-hmm. Now, moving on to Dr. Chris, can chiropractic care prevent future ear infections?
We want the long answer or the short answer?
Both.
Dang it. Okay. Short answer is yes. Definitely can help prevent them. But the long answer, regular adjustments actually help maintain your optimal performance, like Dr. Nat was saying. And so I liked it. Operating at a higher level. This allows your body to go and function at the best it can and give it the most ideal opportunity to perform at a high level. If it can do that, you're giving yourself the best opportunity to win. If you are a professional athlete and you are training and practicing, you are training to be the best. Why not give your body the same opportunity? If it can be the best of its best, you can win and you can beat ear infections. What else can you beat? If you give your body proper function, ear infections, like you're saying, UTIs, other types of bacterial infections, overgrowths, give your body the opportunity. So whenever we talk about prevention of ear infections, if this is working all the time, what pressure is going to be there? Why would it back up? Why would things become stagnant? There's nothing stagnant anymore. It's now dynamic, it's fluid, it flows. Everything is able to move back and forth the way it's supposed to. And then whenever we talk about the communication, that was the other one. If the nerve and the brain and the muscle are all communicating, the body knows what's going on. There's a big long word, it's called proprioception. Your body's ability to know what's going on whenever you're in space. It knows what's going on in the body. It's able to identify before it even happens that we can take care of this, we can fix it, and you won't even know that it's there. You might wake up a little itch in your throat and it's gone by the end of the day. That's because it actually drained. It did what it was supposed to. It got out of your body. Your body flushed it out. Getting your adenoids removed, getting your tonsils removed. Those are your first line of defense. That's supposed to catch all that, put it where it's supposed to, break it down, and then push it out of your body. If you get those removed, then your first line is gone. So now you got to go to your second line of defense. So then your kidneys, your liver, your spleen, all of those are having to work a lot harder. Give your body the most optimal position to win. Keep your spine aligned. Keep your body moving. Keep your body out of subluxations. Keep those out of your body, whatever they look like, whether it's stressors, whether it's a physical subluxation, a chemical, if it's dairy, gluten, other inflammatory things. Keep your body in the optimal level so it can win. That's the biggest thing whenever we talk about preventing things. Chiropractic is very preventative, but most people come in as a last resort to fix the problem whenever it's at its worst and expect it to be gone tomorrow. This is things that have been going on probably since you were born. Give yourself some grace, give yourself some time, and work through this. No medical procedure anywhere has 100% right away, it's better now and it's fixed. No. Give your body the ability to heal and do it the right way so it doesn't come back.
And you can keep your organs and your glands at the same time rather than just cutting that out, because that's not working, right? Cut your thyroid out, that's not
You
working
don't
good.
need that.
Well, there are certain guarantees. It's kind of like, hey, you have appendicitis. You go to the surgeon and be like, at the end of this, can you guarantee that I won't have appendicitis? And they can go, yes.
Yes.
100% yes, I can guarantee that. Like, how can they guarantee that? Because you won't even have an appendix anymore but when I'm finished with you. So we have to understand that there's also that going on and that mindset, and there's a heck of a lot of certainty that comes from that. And so it's like, I want that level of certainty with everything in my health, and you can't have that. I'm sorry, like if you want to keep your body parts, you can't have that. And you do need your appendix, despite what for years they didn't know what the appendix was supposed to do. Now they realize that it plays a huge function of seeding and repopulating the gut microbiome.
Bacteria. The good bacteria.
Good bacteria, yeah, we're right back to it. And so, we want to keep our body parts, understand that, there's time and it takes time and repetition, and we have to allow the bodies to heal. I love what you're saying, because you can't expect to plant a seed today and pick a tomato tomorrow. You're like, oh yeah, I heard this. You're coming to me at the worst, and now tomorrow I should be all back to 100%. Like, sorry, this has been going on for 20 years. Like, give the body the time that it takes for you to heal. It won't be a crazy thing is when you put your body in the optimal state to be clear of subluxation, no interference. Even if it took 20 years for this to come on, it doesn't take 20 years for the issues to go away, which is amazing. Absolutely amazing. It can happen so much faster than that. Love the dialogue here. So Dr. Sean, any risks? Are there risks associated with chiropractic care for ear infections?
Yeah, let's see what the medical insert has to say.
Oh,
We're
yes.
going through. Let's
Dun,
open it
dun,
up
dun.
and see.
I like that it folds up to a whole.
Oh, wow.
What do you see, guys?
What do you see? I see a blank page.
Yeah.
Does it mean because it's wide open, or does it mean because there is no?
There's no risk, all right? So as we look at this, there's no risk for chiropractic care when it comes to ear infections. And I think we really talked a lot about the different, what our theories are, what our thoughts are around this, what we do know works and doesn't work. And when you really get in tune with releasing that innate potential of the body, there really is no downside. There's just benefits that happen. Now, that being said, could there be some side effects after adjustments? Absolutely. As your body's going through that healing process, you might feel like that lymph draining down through your throat, and you could, produce a cough. You might start coughing and get a little tickle in the throat. You could get a little bit headachy as things are starting to let go and release as well. The sinuses, you might start feeling drainage coming through the sinuses. Eyes might water after you're getting adjusted. You also might feel sore and achy. That lymph channel is right around the spine is where we see most of that lymph channels that are happening, and a lot of drainage can happen through that. You can start feeling achy through other joints and areas in your body as well. So there's things that can happen through that healing process as you're getting adjusted. But in reality, these are not really risks. This is just your body going through some of the aches and pains of a healing problem that it's going through. So
I love the medical insert example. I'm just still internal, that is so amazing, because guess what? The things that you'll get whenever you go to the medical doctor, they're not openly giving you the medical insert for those, are they?
No. Yeah, you really have to ask for them these days.
Yeah.
Even though they're supposed to really let you know what are all the risks and benefits of it, but we're not being told that.
No. And
but more people are starting to pay attention, and they're actually looking at the side effects, and they're bringing that to their physicians, and the physicians are getting pissed.
Yeah.
Because they're like, oh God, you're trying to play doctor right now by being an educated, informed consumer. So, and I get it, from a practice standpoint, you don't want the patient to try to tell you how to do your job or what's going on, or because people, no matter what, tend to look at the worst case scenario, and they're like, this is giving me a tumor, and you're like, well, probably not. You're probably on an extreme side of freaking out over here. However,
if you've been on it for 20
massive
years,
list.
It might be contributing to that tumor that's growing.
Yeah, it did for somebody. That's why it's on that list. It absolutely did for somebody, and that's why it's on that list. And to think that none of these things are happening, is being foolish.
And to take it a step further, when you look at polypharmacy, very few medical professionals are actually cross-referencing all of their medications. Sometimes the pharmacists don't know everything that they're on. So they could come and have multiple different interactions that are happening, and nobody's ever warned them of these things. And then next thing you know, they come and they, hey, I'm getting dizzy. And you find out side effect from 4 of their medications could be dizziness. So I mean, it's a really good point to bring up, but
because I mean, how much time does that take? You know, because like you've done that with patients, like where you sat down and you've looked at all the different medications. Yeah. How long from a practitioner side does that take?
If I was working through a patient, that was on 10 to 15 medications, I mean, I would easily spend at a minimum 1, but 2 to 3 hours could easily happen of me just researching, and then the time involved with sitting down with the patient and showing them all those things. So it is a large amount of time, and they just don't want to do it, and most people don't know that.
Mm-hmm. Yeah, so it's not feasible for the medical doctors to go through and do that, or the pharmacists, even if though that's their job, because they have hundreds and hundreds of patients that they're dealing with on a regular basis. And they just can't they can't afford to do that for each person. Otherwise, everyone would go out of business. Right, wrong, or indifferent, that the medical doctors would go out of business. So you have to be informed. One, really the best thing is to be like, I got to figure out a path out of this.
Mm-hmm.
Yeah.
And it's got to be natural. Like it's not like what you supplement these 3 medications for this one medication. Like that's not the answer. That's just feeding that same cycle. It's how do I break free of this? What responsibility do I need to take in this whole scenario, and stop blaming the medical doctor or the establishment or the people, and be like, hey, no, I have the ability and power to make a difference here. And this is my body. I have autonomy over it, and I'm going to make better decisions for myself. Mm-hmm. And I'm going to unburden the other medical doctors or the healthcare practitioners, and stop blaming them for my ill health. It's not them. They're trying to help. Yeah. They're trying to help, even if I believe that they don't always have the best recipe for success to try to help them out. It's not their fault. It's not their fault for the situation that you put yourself in. But the fault to be blamed is really the kind of the cultural misunderstanding that our body is actually designed to heal. Because we believe that it's not designed to heal, that we're designed to be sick, that we're designed to suffer, that we are
born into
broken.
Sin, and so we're broken, and that we're born with all these genetic defects, and that we've got to rely on outside people to help with our genetic defects.
Yeah, and in fact, if we understand that we're designed perfectly, and what we have to do then is start to provide our body with the input that it needs in order to have normal function restored, then you're literally looking at the world in a completely different paradigm. You take back control. You start to heal, because you were healing no matter what, but now you just stopped your body. I look at it like an analogy. If you're walking outside and the pavement is 130 degrees, you're going to be burning your feet as you're walking out there, and you're walking around, stumbling around, going, oh my gosh. Well, your feet are healing, believe it or not. Like the cells are trying to regenerate, but if you just keep standing out there on that hot pavement, then the cells are going to continue to be damaged and destroyed faster than you can heal them. If you just stepped into the cold, it would take some time for the burns to go away, but they would heal, and then you wouldn't have to worry about it anymore. But then you go back to doing what you did before, guess what? It's going to get burned again. So if you keep, you do things like you improve your lifestyle, you start getting adjusted, you allow your nervous system to communicate it properly, well, is that something that I should maintain for life? Well, you better check it. Yeah, because otherwise what's going to happen is it goes back to what the problems that you had before, because things come back. Well, what about diet? You eat a good diet, you're going to start noticing good, positive changes in your body, because you're no longer poisoning yourself, and you remove the toxicity from the food sources that you're putting in your body, and you start to heal. Well, guess what happens if you go back to doing those things? The healing that you had didn't stick around, because this is a moving system. But the crux of it is that your body is currently always healing. It's replacing cells. It's regenerating. So healing is always happening, even if you're at the sickest point that you're in the hospital bed with cancer. Your body is still healing and doing the right thing. It's trying. It never stops until you die. So that there's that spark of life that's always there, and that's what we want to make sure we capture. And we recognize that, and then we put that autonomy back on ourselves to realize, okay, I can be on 15 meds, and there is still a path out of this. and there's still hope for me because my body is tolerating 15 of these different medications with all these crazy side effects, and it's still trying to do something to maintain itself, and it's keeping you functioning despite all the, not only the meds that you're doing, which is causing problems, but the other things in your life that you were doing in the first place that was causing all the problems. So now it's like your poor body. Oh my gosh, your poor body. And so we want to make sure that we get out of that by recognizing first that the body is fully capable of getting out of that.
And we're helping you with your mindset as much as we can as well, and the remembrance of that. Because despite all that, and all the traumas and emotional traumas, like that is a stressor as well, 100% a stressor, and it's the fear that that is what can take people down. And so if there's anything else that we can also be a cheerleader with, is we can also instill like that autonomy, that power, that excitement, that vitalism, starting to realize what is the vitality that needs to be awakened inside of you, and then for you to fully experience that, not live in fear and anger and worry and all these lower vibrational emotional set points that we've all experienced, and how we can up level those so we can.
They're butt kickers.
Yeah, they're butt kickers. And depression, and we've all had different forms of it, and everybody has had all different forms of it, and you're not defective. It's you can pull your way out of it. So if anything, if we can neurologically plasticize by way of the adjustment, by way of having good energies, of giving out the good vibes and having you being instilled in that repeatedly, you automatically start allowing that to be infused inside your body neurologically, chemically, physically, and emotionally.
And also in this clinic alone, we are a community. We build each other up. This life was never meant to go through alone. We are here to build each other up. We're here to walk you down the path. We're here to make sure that you get to where you need to go, whether it's with us outside of here, wherever we need to get you to get to that point of optimal, we are here to help you get there. And I think that's very, very powerful. Whenever people walk in these doors, they feel that, and they know that they're at a place where they're going to get some help and some healing. So
when you were recovering from cancer, how important was that sense of community for you?
Golly, you're going down that one. It's powerful. You're not alone. You're never alone. But if you don't know that, and nobody's ever told you that you're not alone through a process, you can get to a dark place. Like you're saying, you can go through your own depression, and it's a dark place that I wish on nobody. But whenever you see that one spark of hope, that one spark of life, that community that's like, you can do this. And as soon as you realize that you know that you can do this and your body can get through this, you can achieve anything.
How was that for you?
So whenever I was going through it all, I did hit dark places. I won't sugarcoat it. There's times where I wondered what was going to happen next. You're 27 years old and you have cancer that is a less than 5% chance to survive from. Your brain goes to some dark places. But then my brother was a chiropractor. I had a wife, and I had a kid that I didn't know that I was going to have. The sparks of life and those hope. There's one word that I was always told to say: just try. Just try. If you get up every day and just try one thing a day, whether it was stand out in the sun, think something positive for today. Give your body the optimal chance to make it through something, and you can heal. But whenever it comes to community and people, surround yourself with people that want to build you up, because if you surround yourself with those people, you become more like those people. And the more that you're like those people, the more you can build up the others like that. So that has been one blessing that I've had for being here, is I get to surround myself with people that I see as better than myself and that only wanted me to be at their level. And then I see a team that wants nothing but every person that walks through that door to be a better version of themselves. So my spiritual gift as a person is to be able to see the best in every single person, whether they see it in themselves yet or not. That is where I have always been able to take care of people, is because I know that they can be better than what they were, and I know that they can be more than what they are and what they believe in themselves. And if I can elevate them even to a fraction of what they see in themselves, they can achieve anything through this. But that's a part of not just chiropractic, but as Ignite and the people and the community that we have built and what we are. You need love in your life. You need people that love you, and we love every person that walks through that door. Whether we know you yet or not, we love you.
Wow.
Powerful. So powerful. And that's just, like you said, through the community alone. And that's like, despite goodness knows how many different fluids, IVs, and everything else that you've been put on, and doctors with good intentions, obviously, as well.
Those things are needed when they're needed.
Yeah.
It's not like you were saying, you're not bashing anybody. They do the best with the recipe that they were given. And I didn't know at the time either. I was still learning. I made the best decision for myself, which ended up being chemo. And it ended up being that rabbit hole. But I also was learning about chiropractic and how the body can heal itself. So I was getting adjusted. And then after chemo, I went through a rigorous dietary change. I did pH balancing. I did fasting. I did straight nutrition. And I gave my body the best ability that it could to heal. And unless I said anything to anybody, nobody would ever know. Nobody.
Yeah.
Because look at me now.
Yeah.
I did all this while I was in school. So it is a testimony. I was able to get through this, get through school, make A's and B's, and survive cancer, and survive motorcycle wrecks, and survive COVID, and still make it through all of this because of the community that I had and the hope and faith that I had in what I was doing, that what I was doing was correct, but also having a little bit of hope. So, in short, yes, get yourself a community to surround yourself with to make your body and your ability to actually live and make it through this. But if you ever need those type of things from us, we're here to serve and help you as best as we can. And I know that. And I see it every single day whenever people come in. They just need some love. Mm-hmm. Whether it's an adjustment, whether it's a prayer, maybe it's just a conversation. Maybe they just need to be heard. That goes miles and miles for people. So, and I think we offer that very, very thoroughly here.
Cool.
Yeah.
Sorry.
And we'll go ahead and wrap it up now.
Yeah, that was. So we've we've addressed so many other questions along the way. Like we talked about the risk. We talked about what an ear infection is, what causes it, what are the symptoms, how can chiropractic care help with it? Are there any other benefits? Are there any side effects of chiropractic care when we're working with ear infections? We've talked about how does it prevent ear infections in the future? Alternative treatments for ear infections besides chiropractic care. Yes, we talked about it. We know that. We talked about dietary changes, lifestyle changes. Those are all the alternative treatments for ear infections. When should you see a chiropractor for an ear infection? It'd be great if we would be the first line of defense for you. So yeah, it can come in immediately. You probably have already gone to your medical doctor, so we'd actually be second, but that's totally fine. But come in as soon as possible, as rapidly as possible. That way we can help you get to the true cause of what's causing your subluxations. And then can chiropractic care be used as a primary treatment? It can. And again, we don't like using the word treatment because we're not treating anything, but if those are the common questions, that's what we use in the world today. But you can come in so that way we can free you up of subluxations, find and detect and correct those for you, and then, be able to help alleviate some of the issues that you're having. And then the final thing, are there any age restrictions for chiropractic care for ear infections? Oh, nope. I think Dr. Chris talked about it earlier. You can be taken care of while you're a baby inside the womb, while the mama is pregnant, and then as soon as the baby comes out of the womb. It could be within minutes, it could be within hours, within days. So no, there is no too soon when it comes to being able, or age limitation or restriction. There's no restrictions on the ages of whenever chiropractic care can be helpful for you, not just for ear infections, but for any type of issues, diseases, or symptoms that you're having. So I think we're going to wrap it up on that. This has been a beautiful discussion around ear infections and what we as the Ignite doctors here like to talk about, and how we can help with your issues, with whether it's for you, for your loved ones, or for your little kids, and hopefully get them to grow up to be healthy kids grow up to be healthy adults. And even if you're an adult right now, let's get you healthier, right?